So I'm going to start with the NHS, how the NHS worked during COVID and how that impacted on all, but especially women, because we all know a man hardly goes to a doctor unless they absolutely have to. So it's women that are more in getting treatments and missing things and going for screenings and looking after the whole family's health, and everything stopped. So think of the impact on that. It's still to be felt entirely. The other point with the NHS is that the majority of nurses and healthcare assistants and people who do healthcare across the city are women. So my hat goes off and my heart goes out to all those who had to make that really difficult choice as to whether to stay at home with their children while they were dealing with patients with COVID, or whether to live separate for how long. That must have been absolutely heartbreaking for all the families, breaking up the family. No wonder there's more tensions, and it doesn't even bear thinking about. It's horrible. Women suffering from chronic conditions are also less likely to get heard properly by the doctor. They can go in and they can say, we've got this, that, and the next thing, it's just fine. You're just fat, you need to lose some weight. That's what you get. You don't get, genuine recognition of your symptoms in a lot of cases, unless you've really got to push it with the doctor. They just tell you, they make an excuse. It's my experience, it's the experience of a lot of people that have told me about that. Access to GPs has been horrendous as well during COVID, because the GPs won't see anybody. How can you diagnose something you need to see on a phone? Also, waiting all day for that phone call. Why can't they give a time for your appointment? Then you can do other things roundabouts. Women have come and said to me they've been scared to do things like go to the toilet because they're waiting for the doctor to phone them back. And they know that as soon as they're in that toilet, that's when the phone's going to ring. So they sit about, they don't do anything, they don't move, because they're scared of missing that appointment. There's got to be a better way to do this. We'll talk about the impact on mental health, of the whole worry and stress to do with the COVID pandemic as well, especially on women, because we're the ones that bear most of the stress of running a household. I've got a statistic here that 67% of women homeschool children, while only 52% of men homeschooled their children. And while the women were trying to homeschool the children and keep everything else in the household running, because we're the ones that say what needs to be done and keep things going, it's incredibly stressful. So I'd like you to think of your mental health as a drawer of spoons. So each day your spoons are filled. You've got, say, 20 spoons. And you use up, for everything that's stressful or you do during that day, you use up your spoons. So you get out in the bed in the morning. Just doing that might be, because of the stress of what's to come, you might use 2 spoons. If you then have to go for a shower, that could use another 2 spoons. You then have to organise the kids to be able to get them to the homeschool. I mean, during the pandemic, obviously, this, every day it fits this, but when you're trying to get your kids sitting down, all they want to do is play and watch TV because they're home, and you've got to try and get them to sit down and do their homeschooling. There's another 4 or 5 spoons gone. Then you've got to try and get lunch, and then you've got the fussy children that won't eat, and you've got to try and get them to eat, and then there's another 2 or 3 spoons gone. By the time you get to, well, sometimes 12 o'clock in the day, you'd have no spoons left. And you've still got to carry on. You've still got to go through and get the rest of that day done, bathing the kids, making sure they're fed, looking after the house, tidying up, doing the dishes. The list is absolutely endless of the pressures that are on mainly women. And obviously, while the kids were at home, they didn't get that respite that they would have got. No, while the kids were at school normally. And that has a massive effect on, there's going to be a huge, though there is already showing to be a huge mental health crisis coming out of of the COVID pandemic. Chronic illness is something as well that has impacted hugely. There are people that have not had their proper pain relief and no access to pain clinics since the very beginning. And it's mainly women with chronic illness who are trying to access these clinics, but they're not even starting running them yet properly. It's a campaign that the Health and Social Care Alliance is working on as well. And the Poverty Alliance has been doing stuff to do with it as well. And, you know, we've had women telling us that they're in pain daily, but nothing they would normally have got, like a regular injection of something to be able to help, and it's not been available for a very long time. I think mental health issues are very closely linked to chronic illness and chronic conditions. And I know that myself because I've suffered mental health issues, which is actually what led me to doing all the stuff that I do. Because of chronic health, I won't go into what's wrong with me, I haven't got that long. But we have to keep going, and we do. And really, hats off to us all. Give us all a round of applause. Thanks. Thank you very much for listening to me.